All right, call the meeting to order. Approve the minutes. I hope everyone received the minutes and have read them.
You have?
Okay. Would somebody like to make a motion?
I will make a motion to accept the minutes as written.
Okay,
Second.
okay. All in favor to accept? Raise your right hand. All opposed, same sign? Okay. Rescue squad updates. Region 1 is not here tonight. Tammy, Region 2.
Don't have anything for 6, and everything's good with 2. Had lots of calls lately. Having trouble getting those covered during the day, some because of personnel working and not having anybody available. So fire's been picking up some of those and helping us out with that. That's it.
Okay. Michael is not here tonight. Eric, Region 4.
For Rescue 22 has nothing substantive to report.
All is okay then.
I just said nothing substantive to report.
Okay.
Okay.
And 7 and 8, we're starting to get busy, as this is our busy time of year. We still have the problem of low turnout on calls. We're trying to work through it. We're using a Survey Monkey to try to get our members to tell us what's going on. That's it. Representatives, there's a new committee, the Incentive Committee. Fire has 2 members. We're supposed to have 2 members. I spoke with Sarah Avery, and she agrees to participate, and I'd like to participate with Sarah Avery on that. So we need someone to make a motion to that effect, and we need to vote the commission's approval on that.
I will make the motion that Sarah and Steve will be on our incentive committee.
Okay, is there a second?
Second.
And all those approved, right hand? Opposed, like sign? All right, that's passed. Deputy Chief Carroll.
Hey, good evening.
Good evening.
Start with some of the policies that we've been talking about and going over. The first one, fire. It pretty much does with all PPE helmet covers, colors. Maybe based on your certification level, physical, and based on your level of training. So if you are a white helmet, chiefs who are interior certified in level 1 will have white. Captains, lieutenants will be red. Black helmets for firefighters that are interior certified. And these are all helmet colors and certified level 1 interior firefighters. Anybody who is an exterior support, non-certified, and less than a physical level 1 will be a yellow helmet. Orange helmets are for junior and explorers. Blue helmets are for EMRs or higher with a current physical. Anybody have any questions? That's one way to easily monitor on scenes who's allowed to do what. So if you have an EMS person who is a junior and explorer, they would wear an orange helmet also. Or a yellow helmet for non-interior, for extrication types areas, special rescue.
Could you repeat who wears yellow again, please?
Non-certified, less than level 1. So
It's in your handouts.
that's the one I didn't copy, right? So I only have 1 copy. I can give you
That's
a
fine.
but
When's that gonna go into effect? As far as having to have the helmets?
January 23, I think. it
Yes,
was.
January of '23.
right. But if you want to work toward that right now,
So
currently, I encourage you to do that.
That only affects the fire helmet,
Right.
okay? Special rescue and those, they don't do black helmets, so there's gonna still be some work on that.
Okay, yeah, like with Rescue 22, and if we go on a rehab call, you know, that's a, we
Blue
would have
helmet, medical, blue helmet.
blue helmet.
Yeah.
Okay.
All right, moving on to the next one, ID cards. Everybody should have a handout for that. These are usually for accountability and for, colors. If you look at it, level 1 interior or level 1 responder will be black. Card C, going across, I guess go card B next, is non-interior certified. B, if you look at the dots at the bottom, green represented hazmat, blue represents EMR or EMT or higher. Blue card C is EMR or CP or EMS person only, responder, first responder. And then a white card would be your admin. Any questions? Moving on, social media policy. Each one has that. It's the use of digital still and video camera images. This is a way to regulate what personnel are placing and putting on their pages. The standard, our original images or copies recorded by digital still or video cameras, including cell phones, whether personally owned or these devices owned by Oconee County, shall not be distributed manually or electronically to any person, public or private agency, media outlet, website, and it goes on. Authorization to do so can be done by the volunteer fire chief, battalion chief, career fire chief, volunteer rescue chief, hazmat team, or special rescue chief. And this is to regulate what goes on out there.
This is getting changed.
And then at the bottom, like you just said, we're gonna add some verbiage to this, but this is just to get it out, let everybody know we are coming up with one. Everybody good? Questions on it?
No.
All right. Moving on to the next part, physical levels. Physician affidavit. We all talked about the physicals. We're gonna have, basically gonna be in level 1, level 2, and then admin. And this is also the physical results for having a stress test. So that's the physical form. It's the physician affidavit. Level 1, interior firefighter, level 2, exterior firefighting, or let's go back, level 1, interior firefighting, scuba dive, technical rescue, hazmat, all the things that are hands-on, level 1 should be doing. Level 2, support, exterior firefighting, driver operator, EMS responder, dive support, traffic control. And then 3 is a non-responding person. Good stuff around the station. Anybody have any questions?
Can level 2 go in the woods?
Probably need to ask that. That's gonna have to be a doctor question on where that cutoff is now.
Yeah.
Okay.
Because
And that's probably gonna be due to the strenuous level of the, because you can't say, well, walking in the woods at, Oconee State Park to walking in the woods at Brascat Falls to walking in the woods up at, Foothills Trail. So I would probably say in the woods would be a level 1 in my view.
Okay. I mean, it sounds right, because they need a stress test and they need a spirometer.
And level 1 will be a stress test and a spirometer. Level 2 is just a stress test.
So everyone will get the stress test.
Stress test.
We'll get everything.
Right.
If you fail the spirometer, still have the opportunity to be a level 2 and have the option to the doctor to say you're just a level 2.
Just level 2. Again, now, in applying to like Rescue 22, so some of our older female members will have to do the spirometer even though they're not gonna be wearing a tank?
But that's part of the test.
That is part of the,
So,
okay.
but they
so-
won't get kicked out because they don't pass the spirometer.
I see. So they get on the bike and the treadmill and they'll pass that.
But because of N95 requirements, they still have to go through
Okay.
that piece.
That's considered a respirator, N95s.
Got it.
So that's with the physicals that we're currently doing with North Greenville and Upstate. The next form is a health and fitness evaluation or physical physician clearance form. This is what, if you went to your personal physician, you would take, and this tells them what we are doing at our physicals and what requirements we are passing.
After you take theirs and fail.
Yes, after you take theirs and fail. So, it basically gives them a rundown what the front, of what levels we're looking at, the regulations, and on the back, it tells them what the regulations are. Anyone have any questions?
That will be for those members that happen to fail the stress test for whatever reason. They have an anomaly or whatever, they'll be able to take it to their doctor who sees them all the time, their cardiologist. And the cardiologist and all them know exactly what we're looking at. Then they will get that signed off so that instead of you going in, we've had complaints that my doctor didn't even know what he was supposed to sign off. And so this way, he has all the information so that you still have the option to go to your doctor and get him who knows you, not just sees you that one time, to look at the stress test for whatever reason, myself included, has to get someone to go, yes, that anomaly is because of this, and so, you can get it signed off.
So this only comes into play if you fail the county stress test?
Correct.
Okay.
And where would you get this form if that were the case?
We will start having that form on the, ERS, and if you fail, we'll make sure we can get them to you.
Okay,
And that outside doctor will be at your own cost.
That is correct.
We'll have them at the physical site too. For some strange reason, at that physical, they're not signed off. At one of our physicals, we'll have something that they can take with them. Speaking of which, our next physical is June 3rd at Walhalla Rescue Squad. And we still have a lot of openings. Move on to the next to the last one. Quarterly checklist for getting your quarterly checks. We still have some departments who have not turned some in. I am gonna work with getting with those chiefs, make sure they understand that there's a time limit on getting this stuff in and getting their money. It doesn't stay there forever. And the checklist going through, Oconee County, and this is what I go through the chief, we must have access or copies or key to the building. Financial statements need to be completed for that quarter. For the grant station expense fund, any department uses financial programs, except Quicken, they can print that report. We need a quarterly pass down their current personal, hand it from their person, their treasurer, handing in their finances, financial statement. Copy of the run reports, they must be completed and turned in. The vehicle mileage location, there's forms for each of the stations on that, where to fill out for your vehicle forms. And then we need to have a quarterly roster showing who's active in your department. And that's available. We took your first ones and sent it back out. Like I said, it's there. So Excel program, it can easily be changed and deleted and added to. So the due dates. Quarter, like, still have a couple departments missing out from April, the last quarter in April, and we got one coming up in July. So that'll finish out the year. So I will be getting with those chiefs and getting their paperwork.
As an inducement, you are withholding the checks.
Yes. Until the reports are turned in.
Do you want to mention something about the new reporting form for financials, since we're trying to get that?
I have not received the training yet. You're talking about the Bullhorn program. Can you elaborate more on that? I mean, you've been using it. It's fairly
Yeah.
easy.
I've been using it for a year and a half now for 3 departments, and it's easy. It's just a spreadsheet.
Okay.
The only difference is that when you enter in a cost or money coming in, you have to assign it a number, and the numbers are all assigned by the county. So it's just lists that you have of costs and income. And really, I have found that our costs are so repetitive that if you just look back at the month before, well, you're really looking back because you're doing 3 months at a time. So usually you have 1 or 2 months to look back on the same sheet you're working on. And you very rarely have to go back to the codes to look up
Okay,
new
so you
things.
assign a bill or a code,
Yes.
basically.
Operations, that kind of stuff.
And these were all decided by county, these codes. So it's,
They match the county system to where
Right.
we report the same way.
but
We'll question the chiefs on who's using this at the next rest of the
Sure.
chiefs meeting.
And if you want to look at any of my quarterly reports for 5, 7, and 8, and you can take a look at those completed ones.
Yes.
Okay?
Certifications. During the COVID, there was a lot of concerns from some of our responders that, hey, I'm at risk for being in groups this large, and I want to not take my research. Understandable. Upstate has given a 6-month extension from your expiration date of your cards for EMRs. We're only talking EMR, EMT never changed. So EMRs, you have 6 months from the time of your card, expiration date to recert. We have a list, I'm not gonna go through names, but I will be contacting the chiefs of personnel who currently are over that 6 months to let them know they cannot run first responder, primary responses until they recert. And that's sitting through a upstate recert class.
So the 6 month is just allowing them more time to still fill in the research period.
And we did have at least 3 recert classes, if not more, during 2020 and 2021.
And a very low number of involved in those, of students.
One of the recert classes was low, you're correct. Anybody have any questions? And I'm still working with, the only thing on that was image trend. I'm hoping to get with someone who's very knowledgeable at it, give me a good course on that so I can get everybody up to date in it. And that's all I have.
Do you have anything, Scott?
I'm good.
Anything else, you guys? Miss Tammy?
The training committee met Monday night and made a lot of progress on the document that we're trying to get finalized for EMRs for training purposes. Going to be getting back together again the next month, working on that some more. CEP program is about to get up and running, hopefully in July, and that'll be coming out too, information for that.
Hey, Timmy, is there a way we can get anything in writing, just even the template to look at and go over as just kind of
I can send it out to
give
you.
a brief, yeah, just so they can kind of see the progress, because I know you guys have done a lot of work. That way they can start getting a feel of what that looks like.
Okay.
Tammy, this is, Chief Eubanks came in, this is what he worked on, and everybody worked on back in 2018.
Yes.
So,
That's what we're pulling it from.
Great.
Is that CEP you were referring to about our staff doing the CEP? Teaching?
Teaching, we still have to become a DHEC approved
Right.
training site.
So what did you mean by July?
That's the EMR, I'm sorry, that's when EMRs begin,
Okay.
the CEP.
CEPs, we're still doing it with the hospital, and they're still coming over to us
Yes.
for the moment.
For the moment.
For the moment.
Yes,
Yeah, okay.
for EMT.
Yeah, I personally would have no problem going back to them and going, doing it with air, like we used to do.
Yes.
Their big reason for stopping it was COVID.
And now they've reconfigured their training room, so it's not as quite as capacity it used to have.
That it, everybody? The radio committee, I guess I should touch on that. We're working hard. The equipment is slow to come in because of certain integrated circuits that aren't available to anybody anywhere. We have ordered the repeater, it's just is it a repeater or receiver for Lever Hall, Scott?
Repeat, it's a full.
Full repeater for Lever Hall. We got permission to put a full repeater on the water tank in Salem. And we're waiting for a test unit to come in that we're going to use to test in other places to see where we really need to put other receivers or repeaters in order to fix bad areas in the county. Only 4 fire departments have reported on weak areas in their districts. We're trying to get a little more participation. Otherwise, that's about it. Okay. Would anyone like to make a motion to adjourn?
Motion to adjourn.
I will second it.
Okay. All in favor, right hand?